In high school, was thinking about being in the medical field. Didn't know exactly where in medical field or what type of aspect, but had kind of just an interest in serving folks and being helpful. And medicine to me was kind of the first logical step for that. I remember first hearing about the ARMC Academy when I was still too young to be able to apply. I remember thinking that sounds really cool. Who else can actually be in a hospital and see some of those things? I really want to do it. And then I realized I was too young. And so I remember kind of setting it aside and thinking next summer I'll look, make sure they're still doing it. I actually even remember calling up the hospital just to see, are you guys still doing this? And then when I was able to apply, I did. I actually remember it was the very first time I went to the post office by myself, put stamps on like a big package to submit my application. So there's a lot of firsts when it comes to the ARMC Academy, especially in high school, being able to have that type of opportunity. First time driving to a workplace, I remember making out the route, for example, too. So definitely was excited, wanted to be able to have that hands-on experience and just see what things are like on a daily basis in the hospital. I was in a handful of different departments, which was really one of the benefits of the academy, I think. Respiratory and the ICU were the ones that I remember the most vividly and I spent the most time in, but also was in the emergency department for a bit, was in operating as well, and a couple other areas too. There were so many different aspects to healthcare that we actually physically saw or were even a part of. I remember doing diabetes testing, for example, on patients. I remember helping patients onto tables for maybe an x-ray or for some other procedure. I remember very, very vividly my first surgery and a birth after that as well, being able to be in the room, which was very, very special. I remember helping patients being able to literally breathe through the respiratory unit. I remember in the ICU, patient wasn't able to be responsive or to be able to speak, but I remember reading to them and talking with them and just seeing the family and how impactful that was. So tons and tons of special memories that I really still treasure. I remember the surgeries. Obviously, that's something, I think it was a hysterectomy. If I remember correctly, my first one, Michael Jackson was playing on the radio. It was just an interesting time. And it was cool to learn from the doctor. They kind of walked me through all the process. And I've actually seen some surgery since in my new role. And my joke is, hey, I've seen a hysterectomy, so I can probably survive almost anything else. I applied for the academy. I was interested in healthcare, going through the academy. I knew I wanted to help people. I wanted to be in more of a service industry. I didn't quite know exactly what. Healthcare to me kind of excited me because you're solving problems, you're able to help folks, and it's a cool environment. So to be able to see that hands-on was very, very important. Throughout the experience, I loved being in patient rooms. I loved seeing folks get better, the behind-the-scenes aspect of how we're actually treating people. But through that experience as well, that happened to be the summer that Obamacare and health insurance and just United States healthcare in general was being discussed quite a bit. The policy side, where I was able to actually, I can remember being in the middle of the ICU. There were a handful of nurses and some doctors, and I remember all of them talking about insurance and how insurance should be or how healthcare should be delivered from a national level. And I remember just kind of thinking how cool this was to actually hear about what things should be like from the people that are doing it on the ground, and getting excited about policy and policy making that actually impacts on the patients that are there. That, in a sense, excited me more than the actual healthcare providing side. So that was very eye-opening just to be able to see, okay, this is something that's very good and positive, I enjoy it, but here's actually another aspect to this that you can still be helpful, but it's a bigger impact. Learned quite a bit through the experience, being able to be here actually physically doing the day-to-day things that healthcare professionals are doing. A handful of things like just being able to sympathize, knowing that there are folks who are going through one of their worst days ever, and being able to have that bedside manner to help them, to comfort them, to be with their family. Now, of course, that translates over to my role now pretty well, in that you're comforting folks on a daily basis in different aspects. They may not be in a hospital, but they're still going through hard times. So that, in and of itself, I think was very impactful for me, but also just healthcare in general. Knowing there's so many different facets to it, it's very, very complicated. There's lots of levels, and many people are frustrated when they're trying to get better, but also then having to deal with some of the financial pieces too. And seeing it from kind of the provider side, from the folks that are trying to make people better, and also trying to make their experience better too. That, I think, was very important for me, just to see through their lens of what they go through. I've actually recommended students before. I've always encouraged people. I've actually also encouraged other hospitals, especially now in my new role as I'm touring around and talking with others, that what the ARMC Academy is really a huge step up. Just from a pure experience, even if you're not going in the medical field or just have a slight interest, just to be able to see that. How many people do we know actually are able to kind of shadow to the level that the ARMC Academy does on a daily basis and have kind of your first part-time job as well? So I always encourage people to at least think of things like this. I've been with others who have had maybe shadowing, for example, or maybe a day or two with a medical professional or some other professional. But then when I actually explained to them, we were there almost every day, we were working physically with patients, you can tell the eyes get really wide because that's almost unheard of. So to be able to have that experience in this type of setting, if other professions were like that, I think that would be tremendous, but let alone the healthcare industry where there's so much variety and so much ability to really see things hands-on. I've not actually encountered anyone who's had as much ability to see that with their own eyes, especially in high school. Maybe in college or maybe even in post-grad, but to actually have it in high school is unheard of. There's really no reason not to let your child go through this program. Just the learning experience, the aspect, this was kind of my first real job. I remember clocking in. I remember deciding my routes on how to get there. I remember even having to remember to pack lunches for work and just being responsible. It taught me quite a bit about just the workplace, what's expected from the workplace. There are, I can think of really no downsides to having anyone go through this program. There's tons and tons of positives. I know my parents still kind of talk about some of the conversations. I would come home from work and we talk about what I saw around the dinner table. They still kind of joke about that, just some of the surgeries or different things that I happen to bring up. So really memorable time just for our family too. One of the nice things about the academy was that we were literally able to work with patients. I remember doing diabetes testing, for example, with patients. I remember giving them meals and really actually having kind of one-on-one conversations with patients. And I think it almost reframes a little bit of putting yourself in their shoes. No one wants to be here because they're not well. And so just that kind of mental mindset of trying to think of what are others going through and how are you trying to help them as they go through it, was very eye-opening, especially for a junior in high school, and seeing that kind of firsthand. And then now I think, not consciously perhaps, but just in the back of my mind, seeing what folks went through on their worst day, being able to sympathize with them, knowing that one, there's folks that are helping them, but also two, I was able to see how my kind of being patient and calm and putting myself in their shoes was also able to help them too.